of time, I think we'll go to the next speaker. Role of AI in glaucoma management, Dr. Vivek Gupta. Sorry, we have to kept you waiting.
Good afternoon, all. So, okay, it's not moving. Yeah, no conflicts of interest. So, glaucoma is like one of the leading causes of blindness in the world. The latest estimates say that it is responsible for nearly 8% of the blindness globally. And some of the key challenges of glaucoma, where AI is going to definitely having a role, is there are large diagnostic gaps. The meta-analysis recent ones says that nearly 57% of patients are undiagnosed in America, over 90% in Asia and Africa. And within India, the Chennai glaucoma study, ACID study, the prevalence is over 90%. And there are like a lot of challenges in terms of diagnosis, in terms of missed opportunities, inter-observer variations, etc. The Global Commission on Eye Health, led by Professor Matthew Burton et al., they identified three key challenges in glaucoma where AI possibly can play a role. One challenge was affordable and effective screening approaches. Second was effective treatments that prevent glaucoma progression. And the third one was monitoring patients for progression and adapting management. And we know from the principles of epidemiology that it is an ideal disease on which screening can be employed. It has a chronic onset, it has slow progression, and we know for sure that early intervention can prevent irreversible loss of vision and financial burden. Now, when we talk about AI, it's like three terms often come along and these are confusing and these can be confusing. So just to clarify, AI is about building intelligent entities that can compute and work in an independent manner. Turing said, act and think humanly, act and think rationally, and they are provably beneficial. Whereas machine learning is when we are looking at developing algorithms and programs that self-learn. And deep learning is another subset where we are using neural network based architectures for developing our machine learning approaches. Now, the field of machine learning and artificial intelligence has been developed since 1940s, but over the last 10 years or so, we have seen a great explosion in this area. Coming to the individual approaches where AI and ML techniques have been applied in the field of glaucoma and they are being leveraged. So the first and foremost and the most widely studied area has been the domain of fundus photography. Now, these present some of the hallmark features of glaucoma in terms of various disc features, neuroretinal REM, RNFL, etc. And primarily, it is one of the primary approaches which is being used for screening of glaucoma. Now, the AI techniques which have been used for fundus photography, they have evolved over time. The initial approaches, they were based on segmentation, wherein you are basically saying, okay, on this image, here is the disc, here is the cup, here is the disc outline, these are the notches, these are the features which are present on this disc. From there on, we have moved on to the domain of convolutional neural networks and CNN, wherein the algorithm itself is identifying what are the features between the two classes of images, glaucoma or non-glaucoma, which make these groups of images different, and then uses its own learning to identify and segregate and classify new data that it receives. And now we are also looking at combination approaches which are being used, wherein both segmentation methods as well as deep learning methods are being utilized for developing algorithms for utilizing algorithms on fundus photographs. Now, a lot of work has been done. Here is a recent graph on meta-analysis of some of these studies on sensitivities and specificities. The main thing, the take-home message is that we are in over 90% sensitivities and specificities for these algorithms which work on fundus photography. However, there is a slight difference in which if we apply these algorithms on external datasets, not the datasets on which these algorithms were developed, the performance drops as expected to somewhere in the mid-80s range, 80% range. There have been experiences where these algorithms have been put in use in the field. So there was a study in Shankar Narayan Netralaya in the glaucoma clinic, where the sensitivity for referable glaucoma by the Medios AI was over 93% and the specificity was 85%. The same Medios AI, when applied in the community, There, the sensitivities ranged from 73 to 90% and specificity from 93 to 99%, depending upon what is the endpoint. Are we putting disc suspects as referable glaucomas or only glaucomas as referable glaucomas based on the AI results? The interesting feature here was that when we compared AI with a glaucoma specialist, the agreement was 80%, whereas when compared with a teleophthalmologist, the agreement was much lesser. So actually, algorithm was performing better than a teleophthalmology glaucoma fellow in this particular study. And there have been studies in which acceptance of AI has been seen in Rwanda as well. And the advantages is basically it is a low-cost technique, non-invasive, quick, and with the advent of portable cameras, it can be taken out and applied in community settings. But there are challenges in terms of quality of images, variations in cameras. Now, majority of the algorithms that have been developed utilize data sets which are born out of tabletop cameras, whereas few algorithms are based on handheld and non-metriatic cameras, the kind which are being used very commonly in low-middle income country settings. Coming to OCT. Now, OCT has become a standard of care tool for glaucoma diagnosis. It provides retinal structure information in 3 dimensions. And however, the key challenge is currently the cost does not lend its use in primary eye care settings. Using OCT data, the AI and deep learning algorithms have used just the printed out reports, cross-sections, the cross-sectional reports, the 3D data, as well as it has been used on anterior segment and OCT angiography. These are some of the ways AI and ML has been used. One is obviously detection of glaucoma versus non-glaucoma. But when it comes to anterior segment, it has also been used to say whether a patient is having angle closure, is a suspect, or is having a glaucoma. AI ML using OCT, using temporal time-based sequences, sequential data, has also been used to study diagnosed progression over time, but a challenge there has been absence of a standardized definition for glaucoma progression. It has been used to enhance quality of time domain OCT to near spectral domain OCT levels. Generating synthetic data to develop further algorithms, that has been another use of AI in OCT data. And one of these very interesting use cases is basically enhancing our understanding of glaucoma, identifying the relationships between the structure and the function. So which of the visual field points is mapping to which part on the optic nerve head, and can we use OCT angiography to predict visual field deterioration over time? And novel biomarkers using OCT data are also being recognized. The sensitivity and specificity again for OCT has been found to be over 90% in this meta-analysis, which has used OCT for various endpoints. A very interesting development now has been development of these foundational models. Now these foundational models are developed, this has been developed based on unlabeled data. So it has been fed 1.6 million images. Many of them have come from the Moorfield and other from the Chinese dataset. Nearly 1 million color fundus photographs and 700,000 OCT images. And even with unlabeled data, this model has shown over 80% area under the curve for glaucoma fundus glaucoma detection under external datasets. So the field is very, very the algorithms are out there. Visual fields, now visual fields, we are all aware, functional evidence of glaucoma, and within these domains, the AI have been used to summarize the visual field reports. One example is the eye glaucoma application, to identify patterns of field loss in glaucoma, to obviously distinguish glaucoma from non-glaucomatous field losses, and very interestingly, detecting pre-perimetric glaucoma using central 10-degree field data or campimetry data has also been attempted. We are now seeing the advent of multimodal AI, in which multiple sources of information are being combined. We have examples of OCT plus visual fields, fundus photography, and very interestingly, recently, we have evidence of using EHR data to predict progression to surgery from large data sets from healthcare organizations. Patients are using large language models, chat GPT, etc. And evaluations have been done as to whether these are giving correct responses to patient queries or not. And recent studies showed that a chatbot, it outperformed even glaucoma specialists in diagnostic and treatment accuracy to common questions that patients may have. So coming to what we are doing at AIMS at RP Center, so we have initiated glaucoma screening that leverages some of these artificial intelligence-based models using the same Medios AI in our center. And we have a whole structured process of identifying and screening patients. And the glaucoma referral is basically based on the AI output here. We are also developing a curated data set of color fundus images, which we are going to use with our partner Vadvani AI for development of a new AI algorithm. This is a Ministry of Health project by Government of India. And finally, we want to assess the operational effectiveness in field settings and then hopefully scale out this approach. So coming to summary, I mean, like the AI for glaucoma, the results are consistently good on internal validation sets and quite good on the external validation sets as well. The field is rapidly evolving, and obviously it gives huge advantages, especially in terms of efficiency and saving the time of the specialists. There are still a number of limitations. Primarily ones are in terms of ethics, in terms of models that are ethically diverse, and in terms of validation of these models on external data sets. There are issues of explainability of the results of AI. However, those are now being solved by using of activation maps and explainable AI, and those kind of outputs of the AI models, which make the results actually explainable to the physician as well as to the patient. Some of these tools, now currently, at least in the US, there is no FDA approved tool. In India, there is no CDSCO approved tool for glaucoma. We have tools which have been approved for AI for diabetic retinopathy, but this is a non-exhaustive list for glaucoma. What will the future look like? Now, the future, definitely patients are going to be using AI-based chatbots for going to their questions and seeking help. So that is where patients are going to go. For healthcare professionals, for the glaucoma specialists, for the ophthalmologists, AI is going to serve as an extremely important helping tool to assist patient triaging and management. Some of the references, and thank you, happy to take questions.
Thanks for a really wonderful talk. My question is regarding Remedio's glaucoma AI detection algorithm. How much do they tell you about the training set that they used? Who is the population? When I see performance sensitivity specificities in the 90s, that's like an AUC of 0.95 or better. You can't even get that kind of performance in terms of agreement between two glaucoma specialists, right? And so then you also run into the issue of, is your definition of glaucoma the same as my definition? So how are they achieving such high levels of performance?
Well, the algorithm, as far as I'm aware, was trained on a mixture of globally available data sets as well as locally ethnic Indian data sets that were annotated by glaucoma specialists. And the sensitivities and specificities, they have been looked at through 2 or 3 different kind of endpoints. So when the study was done in a clinical setting, so there the entire, all the data sets in terms of OCT and clinical information, IOPs, fields, etc. were available. And I believe the clinician diagnosis, a glaucoma specialist diagnosis, based upon all of these available data, was considered for the gold standard in this scenario. Yeah.
So is your objective to identify all patients with glaucoma, or just a subset who might be losing vision? Like, do we really have the capacity to be worrying about these low-risk early glaucoma cases, some of which don't even progress when untreated?
Oh, that's a very excellent question, because we know it's a very, very slow disease. And there is another challenge in which, like patients being asymptomatic, even if when we are screening them in our vision centers, only 1/3 are turning up. So definitely we need to, this is an area where we need to explore and where we need to see, okay, where do we fix our threshold for referral of cases and how do we prioritize, and can we bring in other technologies into play and maybe identify patients who are at the greatest risk for referral and management. But that's an area of very, very active interest. Thank you.
Very much.